Morning. My name is James Bullion, and I'm the Chief Inspector, the Interim Chief Inspector of Adult Social Care and Integrated Care Systems at the Care Quality Commission. And I have responsibility here at the Commission for oversight of our local authority assurance work, which we're in the thick of rolling out at the moment. And it's a welcome return for CQC and its predecessor organisations to get into the space of looking at adult social care, which we haven't done for, I don't know, around 15 years. So this is a great development of our role on behalf of communities and behalf of government. And it's something, therefore, that we take absolutely seriously in learning and understanding how we do that and its impact. And that's the conversation that we're here to have today. I guess just for the sake of everyone being on the same page, our duties to restart that work after that gap came about because of the Health and Social Care Act 2022. It gives us the responsibility to independently review and assess adult social care functions under the Care Act. The Care Act is about 10 years old now and is an act itself which is also under consideration for renewal. And part of the evidence for all of that and its impact will come from our work in CQC. And this opportunity and this process is all about assessing and rating local authorities and their duties, and it's about learning, which is a core part of how we operate as a regulator. There are 153 councils. That number will shift around over the next few years, but there's 153 upper tier local authorities undertaking Care Act assessments, and we are on track for reviewing all of them this year. So we've completed, I think, around 60 site visits already, and we are have 104 of those councils in our process underway, where we sent the information request to begin the process, or sent a notification letter. And of course, we've published 26 reports on our website, and that number is always going to lag behind the numbers of authorities that we're working with as we go through our process of gathering information. This might seem an obvious point, but as a regulator, we want our work to be based on evidence. We want, therefore, to understand the impact of the work that we're undertaking. And a crucial part of that is how we research into its impact. So we not only want to understand what impact we're having, but we also want to understand how that impact is made. This kind of approach we've adopted right from the beginning of the test and learn arrangements and the piloting arrangements, and of course the commission for this insurance from IFF, which is what is going to be presented this morning. We just to give a sense and a flavour of the kind of areas that we know are an issue around that learning. The information return itself, its clarity, its level of burden. We've already, as part of our process, got some feedback on that and made some adjustments to the way that we're operating, allowing local authorities to bring queries, and reviewing the way that the information return works with the Association of Directors of Adult Social Services and the Local Government Association. And I remain enormously grateful for both of those bodies and for others who help us co-produce our way of working. And it's been a really important part of how we develop this work, and it remains a really important way of working for us as we get into the learning and therefore the impact of that learning on us. Another area is around how we corroborate our evidence and how we make sure our reports are effectively representing that. And again, what's developed over time around our specialist advisors or our expert reviewers has been a really crucial part of making sure that we're on track and that we've got the strongest possible way of working. We're doing more pre-site visit work than we have done before. We're doing more benchmarking and consistency work than we did at the beginning. So this process is developing as we go. And then making sure that the data we report is accurate is another area where actually we've been working with our own data and insight teams and making sure that we strengthen the interaction between ourselves and the local authorities on that. And again, that's strengthened by a feedback loop at the end of the processes where we make sure we get feedback on how that data is operated. So I hope that gives you two things really. One, a flavour of the kind of areas that we feel we've been working on and feel that are important, but also CQC's commitment to sort of take this as a learning process and a strengthening process. We are in a baselining period of 2 years. We believe very strongly that post-baselining, there is a real strong role for us continuing to make an impact on improvement in the Care Act and the context of the social care reforms likely to come out of the Casey Commission. And we believe there's evidence for public assurance and a desire for that as well. So you can't take things forward post-baselining unless you've got some evidence to base your recommendations on for future arrangements to the government and to the Department of Health and Social Care. So we are a learning organisation. We want to learn in partnership, but we need that to be based on strong evidence and properly constituted research. And that's the point of this presentation this morning. So I think I'm going to hand over to Sophie Elliott now, who take us on to the presentation itself. Thank you.
Brilliant. Thank you, James, for that introduction. That's really helpful. Latoya, are you going to bring up the slides for us?
Coming up in a moment.
Perfect. There we go. Brilliant.
Right.
Thank you.
Perfect, thank you. So yeah, thank you, James, and just to reiterate our thanks as well for everyone that's joined us today. Just by quick way of introduction, my name's Sophie Elliott. I'm a director here at IFF. You'll be hearing from me in the first instance, and then my colleagues Tom and Liz will take over as well to talk you through the findings from the research that we've been doing for the CQC. So just moving on to the next slide. Just to give you a little idea about timings, we've already heard from James, and then Tom, Liz and I are going to talk through a presentation of the findings. And then at the end, we also want there to be an opportunity to hear from you in the final section of the webinar. So we're really interested in hearing your thoughts, any questions, any reflections. It'll be really useful to hear from you as well. So in terms of what we hope you will get out of today's webinar, we're hoping it'll be useful for you to build your understanding of CQC's approach to LA assurance, hearing about our findings about what's working well, what's working less well, and areas for development. We'll also look to the future and share what the research has told us about how CQC assessments can support local authorities going forward. As James mentioned, we'll hear about the kind of role that CQC can support local authorities in their improvement journey going forward. Move on to the next slide. So just wanted to start off by getting a quick overview of the context of the research, some of which James has already talked through, but just so that we're all on the same page about where this has come from before we hear the findings. So as was mentioned, the Health and Social Care Act of 2022 gave CQC a new responsibility to provide meaningful and independent assessments of the provision of health and adult social care services within each integrated care system and local authority. And for local authority assurance, the aim is to understand how well local authorities are meeting their duties under Part 1 of the 2014 Care Act. And CQC's approach is based around an assessment framework. And in local authorities, a subset of 9 quality statements mapped across 4 themes are used, which are working with people, providing support, how the local authority ensures safety within the system, and leadership. And in the summer of 2022, CQC undertook a test and learn exercise with 2 local authorities and 2 ICSs to test the assessment approach. And using the learning from this, the approach was then piloted in 5 local authorities and 2 ICSs in the summer of 2023, with the findings used to refine the process ahead of the initial formal assessment period that started in early 2024. And as James described, with now 60 completed and 104 kind of started the process. So to support the ongoing development of these assessments, in October of 2023, CQC asked other IFF Research to explore how well the approach to system assessment is working and understand how CQC can have the most impact, so influence change as a regulator of local authorities and ICSs. And you can see there on the slide in the paler green circles, the 4 key research questions of the research. So they were: how effective is CQC's regulatory approach to LA assurance and ICS assessment? What are the key mechanisms through which CQC has an impact in a system setting? How can the impact CQC have be identified and measured? And what could be improved about CQC's approach to maximise its impact? Moving on, perfect. So this slide shows our research methodology, so what we've undertaken. So you can see at the top there in the darker green squares, the first stage of the research was an initial setup phase to develop our understanding of the assessments and what they were hoping to achieve. So that involved reviewing some documents, speaking to some initial staff at CQC, local authorities and integrated care systems, and undertaking activities to kind of build an understanding and set the foundations for the research. Following this was the main fieldwork phase, so those in pink in the middle. And qualitative case studies were undertaken with 2 ICS and 3 pilot local authorities. We then spoke to staff in 2 of the initial formal assessment local authorities as well. And all of the fieldwork was completed between April and August of last year. And we spoke to representatives from across local authorities and ICSs and a range of staff at different levels as well, to get a kind of broad range of opinions. We also spoke to a range of national stakeholders, so the government staff, those working in the third sector, organisations supporting health and social care staff, as well as CQC staff themselves. And in total, 107 people contributed to the research. And the final stage was analysis and outputs, which you can see there in the light green. Now, this included an analysis of surveys shared by CQC with the initial formal assessment local authorities. So 3 surveys were shared to gather a range of perspectives on the information return, the on-site fieldwork and the assessment reports. And the surveys were first shared by CQC in September of last year, and the data included in this analysis that will be shared, there was 92 responses received from across 36 local authorities. A final report and summary report have also been produced that will be published shortly. These will have the full detailed findings. Today is very much a high-level summary of the findings from the local authorities, but hopefully they'll be interesting for you to hear. And as mentioned, we'll be taking your questions and thoughts and reflections at the end. Tom, did you want to take us through the next section?
Great, thanks, Sophie. Yeah, so I'll just start with some key findings, and just to say, as I run through this slide, there may be some terms that might seem unfamiliar, but we will go on to explain them in more detail within the main body of the presentation. But yeah, overall, it's important to start by saying that there was positivity around the added value that CQC's new role within system regulation has had and will continue to have within health and adult social care. The participants we spoke to within the research as well generally had a strong understanding about the powers of the 2022 Health and Care Act provided to CQC and the rationale for the introduction of these new powers as well, and ultimately what it would mean for them in terms of system regulation. In terms of the assessments themselves, participants were generally positive about the pre-field work activities that took place. They found the information return and self-assessment return to be valuable activities, but slightly time-consuming exercises, as James spoke to in his introduction as well. Overall, they found felt that the on-site stage of the assessment, where kind of qualitative interviews and focus groups conducted, was well run, with CQC inspectors involving the right people in discussions and holding the kind of correct knowledge and expertise to be able to conduct those discussions with, to the best of their ability. And the assessment reports were generally viewed as useful overall, but there were some concerns raised over their accuracy, and it was felt that further triangulation and corroboration of evidence would have been kind of beneficial before and after the first drafts of the reports. So yeah, just moving on to the pre-fieldwork phase of the assessment. So prior to the on-site fieldwork phase, where the qualitative interviews and focus groups are conducted, local authorities completed 2 core activities called an information return and a self-assessment return. With the information return, local authorities received a request from CQC, which essentially provided a list of items such as process, a strategy or policy documents that CQC wanted to review and look over, the time period that this data should cover and relate to, and also just guidance on how best to approach this exercise. And the self-assessment return was essentially a chance for local authorities to assess their own performance against the quality statements that are set out, and this could be submitted in any format. And as I previously mentioned within the key findings, local authorities did find these activities valuable. They felt they encouraged self-reflection and helped them to identify areas for improvement, both in terms of their service delivery and kind of data collection elements. For example, we were told that it was, in highlighting areas where they were delivering a certain service, for example, but maybe felt that like they lacked a formal strategy related to it, or inspiring them to collect more qualitative data and continue to collect it in the format that had been outlined in the information return after kind of finding that a useful structure. We were also told by CQC staff themselves that they found these activities to be useful, as they felt they provided an initial overview of local authorities, which essentially helped them to profile them ahead of kind of going into the on-site fieldwork phase of the assessment. Help them to highlight specific areas of interest that maybe they felt there were gaps in their knowledge or they wanted to explore further during this second phase. In terms of the assessment framework, so overall there were limited comments from local authority staff on how the assessment framework itself was used, but there was some evidence that it was being used, for example, through the quality statements and standards that it sets out, that it was being used to inform staff about what the assessment itself would focus on. So yeah, for example, we were told that it was a valuable tool in supporting local authorities to organise their approach ahead of the assessment and ensure they were preparing and focusing on the right areas ready for CQC's visit. And we've got just some quotes on the side here that just demonstrate these points around the pre-field work, so information return activities at the top, and then the kind of usefulness of the assessment framework at the bottom there as well. So just moving on to the next slide on pre-field work. So obviously there was kind of general overall positivity about this phase, but there were some areas for improvement that were identified, and some that we've kind of have already been mentioned. So the information return was felt to be a time-consuming exercise. This was largely due to local authorities feeling the need to kind of provide as much information as possible to CQC, really wanting to give them as much relevant evidence to make sure it was kind of included in the assessment, and also a lack of clarity around what it is that CQC specifically wanted in terms of the document request. Some across both the pilot and formal local authorities said they spent significant time interpreting CQC's requests or trying to find a document that matched what CQC were asking for, but maybe they had labelled it differently. So just kind of, a bit of contrast and kind of, clarity in opinions, I suppose. Participants from some formal local authorities also felt that some of the tasks in the information return were repetitive, which created unnecessary additional work as well. So as a result, we felt that CQC could improve the clarity of this ask and hopefully reducing the time that local authorities spend on identifying and collating this information, which obviously CQC are already acting upon. Case tracking is also another activity that is conducted by CQC in the pre-fieldwork phase of the assessment. So in this exercise, local authorities were asked to put together an anonymised shortlist of people who they've engaged with, and CQC then selected people to speak to from this list, essentially with the aim of CQC seeing the full journey of interactions that a small number of people have had with the systems, for example, from initial assessment of needs through to the outcome of the services that are received or were delivered. Overall, the feedback that we received was that it was quite clear that this activity needs improving. It was felt to be a huge undertaking for both local authority and CQC. It felt to be a huge undertaking, and both local authority and CQC staff questioned its effectiveness in representing the voice of the people. And CQC staff themselves also acknowledged that finding the best way to do this was quite challenging. We were also told as well that the time elapsed between the local authority selecting cases to send to CQC and then CQC contacting them was too long. This often led to situations where individuals were unsure about when they would be contacted, or by the time that they were contacted, they were no longer available. So overall, we just felt that this activity could benefit from further consideration, and particularly around how to accurately capture the voice of the people in the most effective way. And just to sum up on the pre-fieldwork activities, they play a very important role in CQC having an impact as a regulator, as they obviously demonstrate the quality expectations and support local authorities to make these changes based on these quality expectations. So it's just why it's so important that this stage is delivered well. And that's everything on the pre-fieldwork, and I'll just pass over to my colleague Liz, who will take over.
Thanks, Tom, and good morning, everyone. So we're now going to focus on the on-site fieldwork portion of the assessment, and this was when the CQC inspectors visited the local authorities in person. And this site visit could take place anytime up to 6 months after the information return was completed. Similarly to the overall finding for the pre-fieldwork phase, local authorities were generally positive about their experience of the on-site fieldwork for a variety of reasons. So firstly, local authority staff we spoke to really described how CQC created quite a relaxed and a friendly atmosphere for the assessments, and that enabled staff to feel like they could really bring their best to their interview discussions. Some participants we spoke to directly contrasted this with their experience of other assessments and inspections that they felt were quite stressful or had an unfriendly tone to them. And so we would kind of recommend continuing to foster this friendly environment, and that's something CQC should continue to do. Local authorities also highlighted that shorter timeframes between submitting that information return and the on-site visit were positive. So 6 weeks was given as an example of quite a good time frame, whereas the full 6 months was viewed to be really way too long. And staff described how these longer waiting periods can create an atmosphere of tension, apprehension within the authority, as they're just waiting for the on-site visit to be announced, and it can be quite distracting for people from their day-to-day work. CQC inspection staff were generally viewed as knowledgeable, and they were deemed to have a really good level of experience with inspections generally. And the participants we spoke to thought CQC spoke to the right people within their organisations, and that the information that they collected was appropriate and really covered kind of the key areas of their authority, and a good range of information was collected. So again, we kind of suggest that CQC continue to focus on this and really ensure that their inspection teams are skilled and experienced. And then we finally wanted to touch on the manager drop-in sessions, which were a part of the on-site fieldwork. And this was actually something that was introduced following feedback received in the pilot phase, And in the pilot phase, there wasn't a designated space for the voice of managers within local authorities to be heard. And local authority participants were really happy that these drop-in sessions were introduced in the formal assessments, because the voice of the manager was seen to be really important and a really important representation to have. However, it is worth noting that some staff we spoke to did still wonder if managers should be included in a more structured session rather than just the drop-ins. So again, there were some potential areas for improvement highlighted regarding the on-site fieldwork. And these related particularly to the idea of using interviews to their fullest potential. So one example of this thinking was that we heard from participants that some felt interviews were too short, and the questions that were asked were quite high level and didn't really dig into much detail or much depth about the different areas of the authority discussed. Now, it is really important to note here that keeping those questions at quite a high level and quite broad in general was a conscious decision made by CQC, but this conscious decision wasn't clear, and this intention wasn't clear to local authority staff, and this meant that high-level questioning instead translated to them that CQC staff didn't necessarily have depth of knowledge to probe deeply about the areas they were discussing. And then another suggestion made was around the titles given to the interviews and to the group sessions that were part of the on-site fieldwork. And some felt that these titles were not always reflective of what the content discussed actually was. So one example of this was given where a session title had the word strategy in it, but then what actually ended up being discussed in that group was more related to operations. And participants we spoke to felt like this could lead to the risk of not having the correct people at discussions. So some ideas of how to mitigate these concerns, which you see in the red boxes there, are ensuring that CQC have thorough knowledge and are fully aware of the structure of local authorities and really understand roles and responsibilities within it, of inspections, which means that informed questions can be asked. Communicating with local authorities to ensure that they understand how information is gathered and is reviewed across the assessment process by sharing that CQC approach to fieldwork in advance of the site visit. And then finally, consider sharing the proposed fieldwork timetable further in advance with local authorities and really ensuring that those session names are descriptive and accurately reflect the content. And that way local authorities can really ensure that the right people are always present at the right sessions. And moving on to discussing the assessment periods now, the assessment reports now, and these are put together using information and data gathered throughout the assessment period. And there is quite a lot on this slide, so I'm going to navigate kind of from the top to the bottom and going row by row. So starting with that overall picture, again, we could see that local authority staff were quite happy with the assessment reports. It did feel like they reflected themselves and they felt like they recognised themselves within the reports. And they also thought that the reports were good at suggesting some general areas for improvement. However, there were still a number of concerns shared, particularly related to the accuracy of the detail within the report and also the transparency of the reporting and scoring process. So the first example, which we've already heard in this session, was around factual inaccuracies. And something that came up a couple of times was local authorities questioning financial information, including in reports. That second point also is related to accuracy, in that some local authority staff did feel that there were examples in the reports where it looked like the opinion of just one individual had been included in the report, and it was felt to have been given a disproportionate level of attention. And they didn't think that this one comment had been checked against or triangulated with other viewpoints or contextual information, and that was something they might have expected to have happened. There was also a desire among some for there to be more transparency around the scoring process, because it wasn't clear to everyone exactly how the scores were attributed. So, for example, we heard from one local authority that they said when they compared the write-up in their report with the write-up in another local authority's report, they felt like their local authority had a much better write-up and it was more positive, yet they got a lower score and they couldn't quite see the connection, the clear reason why. And then finally, although local authorities were positive, as I just mentioned, that the reports highlighted kind of general service areas to focus on or general focus areas of improvement, they were sometimes disappointed that the reports didn't provide kind of specific suggestions or specific recommendations of actions. And this also ties in to the previous point about scoring transparency, because some participants felt like it wasn't clear how they could improve their score, and they wanted kind of a clear roadmap of how they could get from good to outstanding, for example. So moving on to the red boxes again, and we've made a few suggestions that could address some of these concerns. So starting on the left-hand side there, CQC could review the practical stages of drafting and agreeing reports to not only reduce those inaccuracies, but also reduce use of jargon and any grammatical errors that can impact readability. CQC could also consider whether to produce a plain English summary, and so this could be more widely accessible and could be read by a broader range of people, for example, the general public. There's also some scope to improve the clarity of the scoring process and the transparency about how judgments are made. So this could involve ensuring kind of widespread use and understanding of the assessment framework among local authorities, just to ensure that the assessment criteria is really thoroughly and well understood. And finally, a further consideration could be given to exploring how CQC can have an ongoing role in authority improvement journeys, provide more concrete input on improvements that some local authorities desired. And I will discuss this in slightly more detail on the next slide. But before we move on from the assessment reports, similarly to how Tom highlighted for the pre-fieldwork phase, the assessment reports are a really important part of the assessment. To date, these are the main way that CQC are having and have had an impact. So it is really important that they are as useful and meaningful as possible for local authorities. Thank you. And then to summarise today, we wanted to take a bit of a step back and look at the bigger picture of how CQC system regulation can support improvements. And from all the staff we spoke to, there really was this clear view that system regulation can and does add value, and that CQC have implemented an approach that is broadly effective when it comes to system assessments. So thinking from kind of our point of view about how CQC could maximise the impact, we had a few suggestions based on the research. So first, it could consider its role in the ongoing improvement journey of local authorities, which we did touch on briefly on the last slide. So to explain this in a bit more detail, we did hear during interviews with local authority staff that they would really value the opportunity to develop kind of longer term relationships with CQC staff that could really add value to their improvement journey. For example, could CQC offer mentoring for senior leaders, which would provide the opportunity to build relationships, but also for CQC to have an informal impact. Another idea shared was that CQC could play a role in reviewing improvement plans as well. The second suggestion is to ensure continued engagement with stakeholders and provide opportunities to contribute. And so this would look like CQC having ongoing engagement with those relevant regional and national stakeholders, and ensuring that they are consulted on future assessment developments. For example, inviting stakeholders to webinars or conferences where assessment findings are shared. And we did hear from some national stakeholders of previous examples where this had been quite effective. So one example shared was of a webinar that some had attended that explained how the assessments were going to work in practice, quite simply. And this was really made national stakeholders feel like the approach was quite collaborative and that they were being kept in the loop. And then the final suggestion we had was around ensuring information on wider CQC activity and relevant system assessments is circulated. So local authorities felt that CQC sharing wider information within the public domain, particularly around good practice, for example, would really help align service delivery across the authorities and make it more consistent and also generate improvements more broadly. When asked about how CQC can have the most impact as a regulator, the triangulation and circulation of wider information was the main thing that was commonly mentioned by participants. And so this point around sharing information really does have the potential for CQC to have real impact as a regulator. So that's all the slides we had for you today. And I think people have been making use of the Q&A box. I'm going to hand it over to CQC colleagues to manage that.
Thanks so much, everyone. We will, so for colleagues on the call asking about kind of sharing the slides, so this work is going to be published, and we will be sharing this recording on our YouTube channel. So all the content that you've heard today is going to be provided in the form of the report and the recording. In terms of questions, we haven't really had many questions come up. I don't know if people want to start maybe putting something in the Q&A section at the top of the call. Alternatively, if you have the raise hand function, we'd be happy maybe to take a few reflections through the raised hand function as well. So we have a question saying, which two ICS areas were part of the pilot case studies?
So we did, the project did also look at ICS assessment approach and looked at two pilot sites. So that was Birmingham Solihull and Dorset ICS, because they were the two ICS sites that took part in the piloting work.
Apologies. Thank you, Alison. And the next question, are you able to share the ratings of the 36 local authorities interviewed?
So the ratings of the local authorities that have had their reports are available on our website, and those are the only ratings that we're able to share. In terms of ratings of there was two formal assessment local authorities that had had their formal assessment, so will have received a rating, and the pilot case studies also received a rating too. I don't have these to hand, but they were, if available publicly, they'll be published on our website.
Thanks, Alison. Next question, are CQC considering the suggestion of more formal involvement of managers?
So what we've introduced since the pilots is a senior leadership team meeting before we get on site. So that has senior leaders that talk to us and meet with us. We have our drop-in sessions, and then we follow up certain things with different individuals within the local authority. So we kind of have a range of methods in the pilot to try to get the views of different people, including managers.
Thanks, Amanda. So we've got a question. Was there a sample of both large and small councils involved in the research?
Sophie, do you want to take that one?
Yeah, yeah, of course. So in terms of the pilot local authorities. So we spoke to 3 of the 5 pilots. They were sampled based on kind of geographic spread, the kind of population characteristics, and the kind of challenges that we were aware of, and the kind of things that we kind of knew were working well, and the challenges in each area. And then there were also some that weren't in a position to take part. So that was the main sampling criteria for the pilot local authorities. And then for the 2 initial formal assessments, it was very much the kind of early stages when we were sampling. So it was those that were kind of had been through that process and were able to take part.
Thanks, Sophie. And apologies, I've missed a question that was asked earlier. So just asking around, given the number of assessors that we currently have at CQC, and the fact that we're learning through the process as we go along in terms of our assessments for local authorities, how are we going to ensure there's consistency of assessments, and in particular applying scores and final reports? So just around consistency of how we assess each local authority.
Yes, so we have a standardised quality assurance process and a calibration panel. So that helps with that consistency across all local authorities. And our assessment framework is the same. So we are making judgments against the same standards for all local authorities. So when we're talking about learning, it's about the kind of tweaks and improvements we're talking about, but the basis on which we form our judgments and carry out our assessments is consistent across all local authorities.
Thank you, Amanda. So there's a bit of a longer question that I don't know if the kind of organisers and co-organisers can see around, did the research look at what data CQC use and how they use it? The context being that CQC are using a national subset of data available, collecting additional data that isn't necessarily standardised and comparable, and seem to privilege the latter over the former. For example, waiting lists / times over, I don't know the acronym, apologies. So it's ACOF surveys regarding people's experience. I don't know if my colleagues can see this question by Damien, just to maybe look at how we can answer it between us. James, you've come on camera, so maybe you can assist. Thank you.
I'll allow colleagues to give a more technical answer. But hi, Damien. Nice to see you. And you're right. I was going to make the point that there is a broader issue around social care data nationally, and the degree to which ASCOF measures really reflect, or properly reflect in proper time as well, the real experience of people. And as you're pointing out, we're also looking at data where there is no standardization actually yet of things like waiting times and definitions. So we are having to work in that context, really, where there needs to be, and one of our findings, I'm sure, will be recommendations for a more standardized approach for national data on social care, and the client level data as well, becoming better and more standardized. I don't think we're trying to privilege the latter over the former, so that sort of non-standardized data over the formal ASCOF. We are trying to create a whole and consistent picture using the both of them, really. But there may be a more technical answer that either Alison or Amanda might have. I may not have got the context of that completely right, but it's a really great question, Damien. I'm not surprised you asked it either.
Just to mention, from a research perspective, it wasn't something that was specifically focused on. We were looking at the kind of overall assessment process, not that specific component, but it is something we'll continue to send out the feedback surveys, so that every local authority who has their formal assessment has an opportunity to feedback, and we review those themes and we submit them to the local authority assessment team. They're chunked into 3 bits, so you'll get a survey linked to the information return element, and then one about the on-site assessment, and then one about the reporting. If there's any feedback you want to share through those mechanisms about the data, then that will be reviewed by the team. But I think it was mentioned up front around kind of ongoing work that's happening to review the data that we look at as part of the assessment process.
And I would just like to reiterate, data is just one source of evidence. So it isn't a case that each local authority, it's kind of like if you're performing better, that equals to a particular score. It's one source of a multiple elements that we gather. And we've also introduced talking to the local authority data teams where they exist, or their performance leads, so that we can really understand that individual local authority's data as well.
Thank you, Amanda. So just continuing with the questions, will the pilot councils be included in the baselining by December? I suspect so, in brackets.
They will, won't they, Amanda? Hello, Natasha. Nice to see you. You've got one of them in your area, but they definitely will, won't they, Amanda?
They will be, but they will be building on the pilot assessments. So while they'll go through the same process, we recognise that they were part of the pilot, so we'll be building on the pilot results as well.
Thank you both. So I've got a question around our quality assurance and calibration processes. Do we have any plans to maybe go into more detail about what they entail? Maybe externally giving some information about it, or holding another one of these to talk about it, potentially.
Yeah, we recognise we do need to provide some more information on our website in terms of the guidance of what we do, but we are quite open about our quality assurance process. It mirrors the provider quality assurance processes in terms of internally. It goes through a route of being seen by another manager, being signed off by a deputy director, being seen by the specialist advisor and executive reviewer that were on site. And the calibration process is a panel that meets regularly, more frequently now that we are doing more reports. And they look at a group of reports together, but we have standing members. So we have a collective view of what we've already seen before. Mary, our Director of Adult Social Care, chairs it, and we have internal and external expertise on that panel. And they see the report now. We've changed it. They see the report at draft stage before it goes out, but they will also see it after factual accuracy if a score has changed. So quite a robust quality assurance process, as well as the factual accuracy process and the right to a rating review process as well. So anybody familiar with provider inspections will be familiar with that kind of process as well.
Thank you, Amanda. We've got a question and reflection, I think, from Karen, just saying, I think we know that really getting the views of people using services is still hard to do well. In provider assessments too, are there any new ideas emerging for how we can do this better across all of our work, including where this might be even more tricky in local authority assurance assessments?
Yeah, I think we'd all agree with that statement. It is something we strive to do all the time. In terms of the local authority work, what we do is we look at what the local authority knows. We do our case tracking. We also have our experts by experience talk to unpaid carers. And we've introduced talking to voluntary and community groups who can gather the views of people as well. And we've recently been having conversations with voluntary and community sector groups around some of the data and information they hold that they might be able to share with us that gives us some more themes in particular areas. So organisations such as Age UK and MenCat, who get a rich source of information on people's views as well. So it's something we are continuing to build and work with the sector on how do we improve on that.
Thanks, Amanda. I think we also regularly use things like expert advisory panels and kind of commissioning work through kind of local groups, particularly utilising our relationship with Local Health Watch as well. So we do have a broad range of ways that we connect with people that use services to understand their experiences of care. So just another question, what CQC focus on will increasingly influence what local authorities focus on? Did the research explore what CQC focused on most and whether they were the right areas to improve people's experiences and outcomes?
So from a research perspective, this is something we're really aware of in CQC, that the standards we set through our assessment framework become the things that are focused on often. So it's something we're really aware of and something we'll have to continue to monitor. It feels quite early to be able to tell at that point. And we'll continue to do research and evaluation to understand what our impact is in the longer term. But it's also something that we're aware of when we develop our assessment frameworks and make sure that they're really robust and looking at the right things. So it informs all of what we do, because we're very aware of this point. And it's even more important, I think, now that we're making sure that the provider level assessment, local authority assessment, and eventually potentially do the ICS assessments are all kind of pulling in the same in the right direction around what we're looking at.
Thanks, Alison. I don't know if any other colleagues wanted to reflect on that one as well. Ali?
Yeah, I think that also links in with some of the work that James was talking about around the data as well, and those discussions about how do we capture the impact on people, because it's not always a numbers game. There's a qualitative aspect to a lot of the impact of the work that goes on in adult social care, but as a sector, that's work that's kind of ongoing, is to understand how we do that, and that will then inform our assessments as well.
Thanks so much, Ali. I think we've gone through all the questions. I don't think I've missed anyone out. I don't know if anyone had any closing reflections. Sorry, just one more question from David Watson. The framework is an assessment framework, but CQC used the terms of inspections and inspector. Is this something that will be looked into in terms of language going forward? James?
Well, there's a internal debate in CQC actually about what language we do use. In the legislation, we are required to undertake assessments, so that, formally speaking, is what we do. But colloquially speaking, we do talk about inspection. We have inspectors in CQC, and I know local authorities also use that term. So I don't think we're probably, even if we decided all to behave in a different way, I don't think we would eradicate that sort of mixture of language in the organisation, really. I hope it doesn't get in the way, though, of people's understanding of what we're doing in practice, which is to essentially look at people's experience and provide a professional judgment about what that means in terms of outcomes, and whether that's then scored and rated is a technical matter for our assessment framework process. I think you will see our assessment framework in a more broader sense changing over the next year as we formally review that as part of CQC's process of improvement. But again, I don't think it will, as it were, pick up this question that David has raised. I don't know, Amanda, whether you've got anything to add to that. I'm quite happy we're living with that diversity of language in many ways.
Yes, and exactly as you said, we use the term assessment, but we know from talking to some local authorities that they've deliberately referred to it as inspection because that's the language that's been understood. And so whatever helps, really.
Thank you both. Really helpful reflections. I don't think I have any more questions. Every time I say that, there's another question. So interested if local authorities are being surveyed just once following their assessment, or they will be surveyed again down the line to potentially look at long-term impact of local authority assessments.
That's definitely something we could look at. We're currently in the research and evaluation team thinking about the kind of ongoing work that we can do after this piece to kind of pick up how we understand our impact in a longer term way. So that might be something that we consider doing.
Thanks, Alison. I'll just give a sec for any other questions to filter through before we start to close the call. Mary Gridge.
Yeah, thank you. Just on that last question, there will of course be life after the baselining. So we're just starting to think now about what baselining assessments will look like. So talking about into 2026. And one element of that will definitely be to sort of that we will learn about what the impact of what's gone before has had. So there'll be other ways and continuing engagement with local authorities to help understand our impact in addition to anything that the research team do. Thanks.
Thank you so much, Mary. I think we've come to the end of the call. I just want to thank everyone so much for participating and for the research team for the work that they've done. We will be sharing this recording online, so you can kind of share it amongst your teams. And then the report will be published soon. And yeah, please keep abreast of our local authority bulletin, which will have all of the details from this call, including links. Yeah, thank you very much, everyone. I don't know if my colleagues have any final reflections before we go.
Just to add my thanks, Latoya, to yours, for people being interested in this, and you know, in the spirit of openness, keep the feedback coming into CQC, please. Really interested in what your reflections and experiences are, in addition to the formal research that we're undertaking. So thanks very much.
Thanks all. Have a good day and have a good week.
Thank you.
Thanks.